round of questioning. Dr. Jacobson, thank you very much for being here. According to your presentation, you are stating or underscoring that there is a correlation between urban cities and the high incidence of omittance carbon dioxide and the negative effects it has in different cities in California. Now, Los Angeles is very different from, say, Bakersfield or the Central Valley. Can you just touch on that, what some of those, how that is occurring, what that process is there?
Okay. In terms of carbon dioxide, well, a lot of the pollution in the Central Valley is due to particulate matter air pollution, as well as ozone. And in Los Angeles, it's also due to particulate matter and ozone, but sometimes different times of the year. The carbon dioxide is emitted more, there's more carbon dioxide emitted in Los Angeles, so the CO2 levels in Los Angeles will be higher. However, the Central Valley does emit its own and also receives a lot of carbon dioxide from the San Francisco Bay Area, as well as coming from the south from Los Angeles. And there are going to be, the Central Valley is more spread out, so you expect the ozone changes in particular will be over a larger area, but it has a slightly lower population in concentration, in terms of its concentration compared to Los Angeles. The pollution in Los Angeles will be affected the most. I mean, the health impacts will be greater, expected to be greater in Los Angeles because you have such a high population, and the levels of ozone are generally higher in Los Angeles than in the Central Valley. And the pollution will get worse where the pollution is already bad.
What will happen if we take no action?
Well, right now, historically, temperatures have already risen due to carbon dioxide, and this is currently causing about, I would say, estimate a median value of about 800 additional deaths per year, compared to the background of about 50,000 deaths per year due to air pollution. The background air pollution death rate in the U.S. is 50 to 100,000, and per 1 degree Celsius or 1.8 Fahrenheit increase in temperatures, that's about estimated as about 1,000 additional deaths with a range of 350 to 1,800 per year. So far, the temperatures have already risen about 80% of this, and so deaths are already occurring. In the future, they're expected to occur more. So the problem is already here, and the deaths are already occurring.
Do you agree with the decision that EPA made? Do you have any comment on that?
No, I disagree with the decision for the reasons I cited in my testimony, that there's no basis in science that we know of right now for the two main reasons that were cited by Administrator Johnson. I mean, those were assumptions that he made. That the two assumptions he made were that first, CO2 just mixes globally. There's no differential effect on health in California versus the U.S. as a whole. And there's no effect of local carbon dioxide on air pollution in California. Those assumptions were just those assumptions. They weren't based on any science that I'm aware of.
Were you aware if there were any scientific evidence that was put out prior to what your research told you? Was there any information from EPA that you may have seen?
No, I'm sure there have been no studies, because the study I did, which was published on February 12th, 2008, is the first study to look at the effects of carbon dioxide specifically on air pollution, ozone, and particulate matter and carcinogens in the United States as a whole, and on public health. There have been no previous public studies at all.
All right, thank you. My next question is for Dr. Frumkin, and I apologize if I can't get to everyone, because you all had very good testimony, and I want to thank you for that. But Dr. Frumkin, we've heard from your colleagues that there seems to be a need to increase funding in the area of global climate change and its relationship to health and children, and the need to kind of fast forward funding so that we can be prepared. In your opinion, what can we do to help provide more support for your particular office?
We're doing what we can now in terms of public health preparedness and prevention with respect to climate change. We have technical assistance underway. We have research programs in a very small way underway. We're building the science base and so on. We recognize the possibility of doing more. Further public health activities would involve further research. We need to build our science base considerably. technical assistance to state and local health departments would need to increase.
Is your budget adequately funded to provide for these kinds of research developments that we need to undertake?
As I said, we're doing everything we can within existing resources now. We do recognize the possibility and the opportunity of doing more.
So you could use more financial support, funding for research, preparedness, yes or no?
With further resources, we would be able to do more.
Okay, very good. I think my time is up, but certainly we'll come back and ask another round of questions so we can get to more of you.